Hello, welcome to Podsongs. I'm Jack Stafford, and I interview inspiring people in service to others as inspiration for a new song. Today, I'm speaking with a doctor who's published over 1,200 peer-reviewed articles and is one of the top 10 most cited researchers in medicine. In fact, he's been voted by his peers as the #1 most influential physician in the United States. His principal scientific focus has been on genomic and digital tools to individualize medicine, and he's written 3 best-selling books related to this. He's also a big activist for the White Coat Revolution. There's a lot to talk about with very inspiring Eric Topol. About your books, which are all fascinating. So, is there another book coming along?
No, no book. The deep medicine book took so much out of me that I need a recovery period. I don't know if I'll do another book. It took 3 years to work on that, and that's just I was out early last year, or 2019, I should say. So almost 2 years ago now. But maybe in the future. But I haven't really been working on anything yet.
Yeah, you went deep with that.
Yes. And so, what would be the next one? Deeper medicine? I don't know. I've thought about the pandemic because there's a lot of things we've learned from the pandemic, but I'm a little concerned that there's going to be so many books about it. And, I don't know if they'll be worth, really delving into it, but something to think about. I have talked to a couple of colleagues about possible, but not unclear, and it's a little different. My bent has been trying to map out the future rather than use the past. So, it would be a real change from things that really grab my attention.
I saw that. I read that. It's a very interesting article you wrote in the New Yorker about why doctors should organize.
Yeah, that's something that I think has become increasingly vital. The reason, before the pandemic, we had a global crisis of burnout, and we had, more than half of physicians, and also involving nurses and other clinicians, but more than half had suffered, serious mental burnout, and then a subset of that was substantial with depression and the record number of suicides ever in the medical profession. So that was before the pandemic, and now it's gotten considerably worse. The reasons for that were, in the beginning, there wasn't protective gear, and there were the overlords, administrators that were, suppressing the doctors from talking and complaining, which they had all the right to. Mm-hmm. And then, as it progressed, now in the United States, there's been past the break point. The pandemic has crushed so many health systems around the country where, we've had patients that are sitting in the gift shop, as if it was an intensive care unit or a conference room, or sitting out in ambulances for hours waiting to get into the hospital. I mean, things have really come to a state that is nightmare. It's a horror show that I could never envision. Now, instead of the country protecting its health resources and keeping mitigation measures at the max, they were relaxed to favor the economic, get business going. And so again, we had no representation of a medical society. We don't have one that is first and foremost interested in the patient-doctor relationship. Mm-hmm. The ones we have are mainly trade guilds. And so they just are trying to get reimbursement up for their constituents. Well, that's interesting, but that's not what is led to the erosion of healthcare. So to me, it's more important than ever that we develop a professional alliance, not necessarily what I would ever consider a union of physicians. Ultimately, that could extend to patients as well and all clinicians. But ultimately, the gravitas, if we had the 1 million doctors in the United States, or a good portion of them, standing up for, you cannot relax mitigation measures because we're going to be overwhelmed. We absolutely have to have protective gear if you have to call out the Defense Production Act. So we don't have an organization that represents us. And that's even more striking in that we have this new potential remedy of AI to make our lives better, but it could also make it substantially worse because the same overlords that didn't stand up to protect us and patients will say, oh, well, you have all these algorithms now. Why don't you see more patients quickly? Read more scans, read more slides, and on and on. So you see, this could be used very much against the medical profession and exacerbate the problems that we already exist, which is, it's the same as the pandemic, putting business first. If you put business first, you erode the healthcare because that's basically a human touch, human connection. You need time. You need the gift of time to listen to patients, understand them, to, get into what is really their diagnosis and their anxiety, their concerns. And, that takes the human presence, integrity of the trust, the compassion. I mean, people need to know when they're sick that their doctor has their back. They don't know that anymore. They just don't know that. Now, that's because business prevailed. And, just see more patients. You have 7 minutes to see your patients now, 7 minutes. That's why you interrupt the patient typically within seconds because you don't have time to listen to the patient, no less do an adequate physical examination in 7 minutes. I mean, my goodness. So that's what we have now. And the pandemic was the same thing. We knew that if you want to get the pandemic under control, you have to control the virus first. And then things fall in place. And we have many countries around the world that did that in an exemplary fashion. But in this country, we never contained the virus. And now, we've gotten up above over 300,000 confirmed cases a day, over 4,000 deaths in a day. So this is all an outgrowth of putting business and economic concerns as the priority over preserving health. And then things fall into place. So it's very much a parallel between the two.
Healthcare is the biggest business in America.
Absolutely. And it just keeps growing. What's interesting is in December 17, there was a new thing that happened in the United States, which was a kind of sentinel event. And that was that the healthcare workforce overtook all other sectors of the economy. So it used to be retail was the biggest. Well, and it just keeps growing. So since then, it's continued to grow. And so now we're at $3.7 trillion a year of expenditures for healthcare. It is the biggest business by far. There's nothing else close. And the workforce just keeps growing because it's just feeding the beast. What drives the cost of healthcare is the workforce. The personnel is the number one line item. So it's a real problem in that we don't do anything to try to lean on machines, reduce the human capital, reduce because the more people, the more business, the more, drain on the economy. I mean, it's just it's a self-perpetuating mess. Yeah.
Yeah, it's not a pretty picture.
No.
No.
Oh.
But you think all these hospital administrators would rather get the AIs in and then increase productivity, and in some Asian countries it's down to 2 or 3 minutes, isn't it, the visitor times?
Yeah, I know. When I visited South Korea, it was 2 minutes.
Wow.
It's actually extraordinary, and so it isn't just the United States, although we are the big outlier in the amount of money we put in for healthcare, and our outcomes, of course, are not at all commensurate. They're one of the worst of all the industrialized nations in the world. So, the problem we have is profound, and there is no. I mean, you say, how do we fix this? Well, the first thing, again, I kind of go with these pandemic analogies because they're so interesting. If you fix the doctor-patient relationship, I believe that's the start of the foundation for fixing what's wrong in healthcare today. just as you get control of the virus, you then everything follows suit. So they're very much. I would equate the patient-doctor relationship as the virus. I mean, we don't have that treated. It's in the intensive care unit right now, and it's I don't say it's not going to die, but it's threatened. I mean, I've been a physician too long in some respects. I mean, I'm an old dog, but I started in my training after medical school in the late '70s, and I've watched the demise. I watched it steadily. When I was first out, I could see a patient and take all the time I needed to feel that we nailed it. We got this. Now, I mean, I still am lucky because I have help and I can spend time with people, but I know that's very atypical. I don't know how you can practice medicine when you don't have enough time and you're forced. And in the Deep Medicine book, I wrote about what it was like to be a patient. And I started out with the orthopedist who did my knee replacement and how he had 20 people in a hall that he was going to see. I was probably number 16, and everyone got 1 minute without even an exam, or maybe 2 minutes. And that's, you just can't practice medicine like that, And it was very clear when I tried to explain to him that, I was having a really tough time. He was rushed. He didn't have time. He had the other 19 patients in the hall, in rooms, waiting to see him, and he was already behind. And I'm sure he's like that every day. And it's not necessarily his fault, but that's the business of medicine.
Especially in America, where you pay so much for it. It's all virtually private. I mean, I'm English, so the NHS is a national institution there. So, we expect it as part of our...
Yeah, so you're right. 70% of the healthcare is the private domain. That's why when I did the review with the NHS, I was so impressed about the way that system works. I mean, I know it isn't perfect. There is no health system in the world that is, but I love the equitable aspect. I love the fact that every person in the UK was looked after by the system. And I also, when I'd walk around in the time I wasn't in meetings, and I just would, whether it was a cab driver or people that I ran into, I say, "What do you think of the NHS?" And they all had glowing terms, every one of them. Mm-hmm. And I actually got sick when I was there, one of the trips, and I experienced it directly as an outsider and said, wow, and I don't think I was getting, any special care as a non-resident. So, I think what's extraordinary is we have a model that's quite good. And, it's interesting because the U.S. disses it all the time. They say, NHS and Canada, socialized medicine. Well, what do we have? This is not a model that you could diss any other in the world. I mean, this is the worst. We have, 25, 35, whatever million people who don't even have access to health care, no less the things that we've been discussing, Jack.
Mm-hmm. I've heard that it affects the psychology, the deep fundamental makeup of the population, because one of the reasons my parents wouldn't emigrate is because, we've paid into the NHS all our lives, it's there for us. Whereas in America, people are very nervous now when they're getting older or faced with any problems.
Right, exactly. And we overcook everything, because it's a business. Everybody who gets into the system and has insurance, they get bilked. Right. They get churned. Yeah. Okay, well, we got to do this test. We got to do this procedure, this operation. So part of our bad outcomes are because people are getting things they don't need to get. And there's a risk of all these things. So we are good at incidentalomas, finding things that shouldn't be found because the person doesn't need to be fixed. Yeah. But they have this delusion that it's good to fix things. And that's a real problem. So we actually have this very unusual syndrome. And that's interestingly during the pandemic, because people were afraid to get medical care, there's been a lot less incidentalomas. Kind of interesting. Yeah. Because You know, people are reserved about, going into a COVID zone. So they just stay home and kind of, so we're leaning back the other way, which is, perhaps the more dangerous one, which is under medical, but we have been overcooked
Right.
for years, for as long as I can remember.
I was reading about the number of hospital beds is decreasing every year as technology increases. And now, obviously, with COVID, we need beds more than anything. And this is what's causing people the lockdown. I mean, I live in Italy now, and we're having a lockdown because the hospitals are overloaded.
Right, right. And the ideal thing is you want to do that before they really get overloaded, because once you hit that point, you're at the hockey stick part of the curve. So yeah, no, the difference too is, here we have the so-called, like in California where I live, things are bad, Southern California especially, and that we have a stay-at-home order. Well, it's a farce. If you were to go out on the streets, take a little ride around or walk, it would look like there wasn't even a pandemic here. There's no enforcement. It's just in name only, and if you look at the mobility maps, by things like you can get through Google or whatever, you see that there's a little bit less mobility, but nothing like what you'd expect if you say stay at home. So we don't, I know from colleagues in Italy and many other parts of the world, when there's a stay at home, it's the real deal. And if you go out, you get fined or whatever, right? So I assume that's the way it is, right?
Oh, yeah. I've spent months in the house.
Yeah. No, here this libertarian, this thing about it's a flu, it's a hoax, it's all this stuff. Here we are, we're getting into a year on this, and people are still carrying on that this is not a serious issue, and we have no way. We don't enforce it, and we put up with it. And so this cultural thing is definitely part of the problem.
I heard you with chatting with Martin Kulldorff on the Tom Woods show. You were debating, and that was very interesting. I think you both you both met in the middle on many things, though.
Well, I think he mellowed a little bit from what I expected he'd come out as. The Great Barrington Declaration, I think, was unfortunate because it really, without a scientific basis, and breeding herd immunity, natural infections, which I think was a real flaw, and many accused it as being reckless, including the incoming CDC director, Rochelle Walensky, appropriately, and it led to the John Snow. I think the whole idea, though, is that I'm happy to have a debate. That's why I accepted it. I was going into the lion's den of a very conservative podcast, kind of like the Fox News or the Newsmax type thing, but. I think it's good to have these intellectual debates and to do it right. And, I give Martin credit because he, at least during the debate, he came across, logical, rational. I think the problem is we had a fellow named Scott Atlas who advised Trump and took these principles and used it as a means to provide advice on how to run the pandemic. And that was extremely damaging. It hurt a lot of people. Probably, who knows how many deaths were incurred, no less long COVID. So this philosophy of just let it rip and just protect the focused elderly, the focused prevention is what added to the American strife during the pandemic.
So you were also in favor of not having a lockdown. Is that right?
Yeah, I don't think we need lockdowns. There's so many things that we can do that we're not doing. Right. And I outlined it, of course. I think he agreed that rapid home testing would be important. Yeah. He actually wears a mask when he goes out, which interestingly, it wasn't even mentioned that masks were helpful in their declaration, which, talk about denying the obvious. So, there's so many things we can do. We should never have to get to a lockdown. We just don't do these things, So, I'm just amazed. Part of this is bureaucratic because we have in the UK, what's interesting, there in the UK, you have some of the best exemplars of science and research. Recovery and the ICNARC, which is the ICU registry. You've got the genomics that are doing ahead of the curve. All these great things, but the public health has been bad for managing the pandemic. And here, I would say because we're 6 times the size, we're far worse. But you have so many other countries that have been able to really perform and stand up to the virus and see it as a common enemy and pull out all the stops and never have a lockdown. I mean, there was never a lockdown in South Korea, in Japan, in Vietnam, New Zealand. I mean, these countries were able to manage things without having to put their whole country, into that mode, and many more. Those are just some examples. Thailand, Taiwan. I mean, there's a long list, and they're not just in Asia. So I think we should learn from them, just like we would learn today from how to do vaccinations.
Yeah, I think you were both in agreement that it was bad leadership, really, not no home testing kits, for example, would just kind of the basics now would make a huge difference to open the schools again, and I know it would help in Italy.
Yeah, I mean, the schools thing is a great example, that if you did it right, you'd have every student, every bus driver, every teacher test in the morning before they go in. And if they're infectious, you keep them home. And these tests can be done, for $1 or less a day. Also, they should be supplied by the government because they should accept responsibility for the mess we're in.
Why haven't they rolled those out then?
It's befuddling because they were ready in April here, some of them. Now there's more than 20, more than 30 that are ready. They will be approved, this so-called EUA, emergency use authorization, in the weeks ahead, but we've lost so much time.
April, my God.
Yeah. I mean, it's unconscionable because these tests are what we've desperately needed to navigate, to know if you can go, if you can travel, if you can go to work, if you can, and this stupidity of using, a temperature, take the fever. I mean, that is the most inane way to monitor COVID infectiousness. But that's what's being used today still in most employers. They're taking temperature of their employees, either with a, infrared thermal or, with a regular thermometer. It's just incredible stupidity.
I had to travel from Amsterdam back to Italy, and I had to pay 120 euros for a next day test.
Oh, yeah.
So
see, that's absurd, but it costs so much money.
Yeah, that's
a huge amount for something that should be, at the cost of pennies.
Yeah,
the true cost. And it shouldn't have to be the nasopharyngeal. There's good data now that saliva works as well, and these rapid tests are good. And then the other thing is, even if your test was negative, you still, by the time you got onto the plane and, moved on to your destination, you still could be a carrier. So, the testing like that is, this is why continuous assessment through sensors is a far better way than a one-off test. Or if you test every day and you see now we have a change. So, but the continuous measurements that we've done with sensors, whether it's through a smartwatch or we've been working with this little sensor here now, it's the size of a quarter, and it's got incredible data that it, continuously you just wear it on your chest for weeks on end. That's, to me, that's where AI can kick in. That's where it can make a difference in the pandemic, both for detection, surveillance, and also for people who are sick to keep them out of the hospital, to hopefully monitor them safely where they don't have to go to the hospital, especially since our hospital resources are maxed out.
That's great you're bringing it around, because I've already done a song about the pandemic, so I can't do another song about that. So because that is the theme in your work, because so many people, so many doctors obviously can see this terrible crisis in the medical profession, and they come up with different solutions. Many say the diet, or lifestyle changes, and then you're coming from the technological angle. So what kind of drove you to what drove you to that? Is that because it's inevitably coming?
Well, I think what we're missing here is that we can understand each individual in an unprecedented way, not just their genomic sequence or their gut microbiome or their environment through sensors or their physiology, their anatomy. I mean, every level of a human being, we can go deep. And we can do that. We can do that on a continuous or frequent basis. So we are all over this. I mean, we got big data per person, but no human being can assimilate that data. Now, the point here is that the reason why we don't do well in medicine, one that we talked about, Jack, is about the lack of time and the wrong misdiagnoses that occur. The reflex of sending people for more procedures and tests because we don't have enough time to talk with them and trying to sort things out before we just keep sending for more tests here. So if we had a lean on machines, the counterintuitive thing is, well, that'll make things even worse. Well, no. That's actually what we need. We need technology to rescue the humanity in medicine. And so this is what excites me the most. And obviously it's contrarian. A lot of people don't believe it. That was the premise of the book. And it's pretty much the premise of what I've been working on for the last 15 plus years. All three books. And also, why I was so interested in genomics back in college in 75 and wrote a thesis about prospects for gene therapy in man, and it took 40 years, but, it's been my interest forever, which is if you have more information about a human being, you can do better for that person. And the dream for me is that we can prevent diseases finally. And if people do get the disease, we can manage them far better on an individualized basis. But the prevention of diseases is actually getting pretty exciting now because, like, let's say cancer. We can now tell from your genomics, no less your family history, but much more through genomics, if you're at risk for developing cancer in your life, which type of cancer perhaps, and when you might see it, early or late. And we can do now, starting now, a blood test, a single tube of blood that we could do every 6 months or a year. And we could pick up cancer microscopically before it ever became something you could see on a scan, which is incredible. And I don't think people have lost this because, hey, there's this pandemic and we're just fighting for survival. We have an existential threat. And meanwhile, the things that are going on in every part of medicine like that are, very exciting. And it's technology. It's being able to understand the risk, whether it's heart disease, whether it's the different types of cancer. We can evaluate and assess risk with tests that cost $20 of a gene chip, which is just, testing common typos in the genome, 1 million of them or so. So the fact that we can combine genomics and, this digital, it's a type of digital information. And then the idea of having a virtual health coach. So let's say you, Jack, we had all your data from the time you were born, maybe even in the fetal state, to right now, where you are right now, all your data, that wherever you traveled and had medical care, the sensors, your genome, whatever your gut microbiome was assessed, your environment, all that data continuously assessed. And when that was done, it would be talking to you, an avatar or sending you a text, whatever way you picked, that your machine was talking to you to be a health coach. And say, Jack, what you're eating right now is not going to help your risk for colon cancer. This medical conscience based on facts and all the literature, by the way, pertinent to you, sucked in and part of this virtual health code. We'll get there eventually. I hope it doesn't take 40 years like gene therapy did, but we'll get there. And we have the tools to do that. We have the AI tools, we have data coming, all these different fields. We don't have the will, but we have the the ability now. Not this is not for everyone. Some people say, I don't want this, big brother health coach with all this data assimilation. But you know what? A lot of people, once they show that it really benefits them, what we show in prospective randomized trials where half the people have a health coach and half don't, and maybe they cross over later after a year or whatever. Eventually, it'll be proven that they really help people, and they're easy. You can change the level of intensity, from only contact me when it's pretty important to be all over me, help me all the time. You could dial it up or down, but virtual health coaches are going to be important. The one-off to the doctor, the one-off visit, that's just not enough. Not with all this data that's flowing all the time. And by the way, almost all of it is not in the electronic record. Most of it is outside of that domain. Your genomic sequence is not in your electronic record. Your sensors, it could be a smartwatch, it could be your phone, whatever sensors you have or will have, they're not in the electronic record. So there's a lot of stuff, and your environment's not in there. Your activity's not in there. Your sleep is not in there. Your nutrition's not in there. So much stuff is not in your record. And the medical profession relies on what's in that record, which is farcical. And in this country, we only have one record because people go to 7 different health systems and doctors. And so we only have an ice-pick view of any individual. We need all that brought together to help people.
To assist the doctors, not just to diagnose us, though, but to assist them.
Yeah, and what I'm getting at is more autonomy for patients. Right. Because the doctors, only can cue in, at a certain point in time when your virtual health coach says, Jack, you got a problem. You better see the doctor. I'm going to make an appointment for you on Tuesday. You're free. I looked at your schedule. You're free on Tuesday, and I want you to see, Dr. Jones. That is happening. It's going to happen eventually. I don't say it's happening now, but we're capable of doing that now. So the point being is that the more patients take charge, the better the patients who have a serious matter can have time with their doctor. Right. So using technology to promote patient autonomy helps to decompress for the people who really need doctors, and doctors who really need patients to have, that relationship fostered.
I heard you talking about this scanner that connects to your smartphone. You did a selfie of your whole body, every organ. Is that the future then?
Yeah. Oh, sure. I think smartphone ultrasound is one of the most powerful tools I've ever seen. And as you say, I was so enamored by it. I couldn't image my brain because of the skull, but every other part of my body I could image. And that total, body medical selfie, is a matter of minutes, and every organ. And I say, wait a minute. Now it's actually a stunning thing because anybody can do this. The point being is you use AI and you say to the AI, I want to image my heart. Mm-hmm. And the AI says, well, put the probe on the chest, near the breast, and then I'll tell you how to move it. And so it then says, well, you need to clock it, you need to move it up, you need to move it down. The AI will tell you. And as soon as the AI sees the heart the way it wants it, it automatically captures it. Okay. So my 6-year-old grandson could do an echocardiogram through AI. Now, what does that mean for the whole world? That means and that's the hardest thing to image is the heart because it's moving. There's all these different views. It's a lot easier to image the gallbladder or the liver or, most of the body is easy to image. The heart is more challenging. Anyway, AI is going to change that again so that, anyone, anywhere, anytime can use a smartphone with a cheap probe they'd have in their pocket. And then they could have that automatically analyzed or sent to an expert or whatever.
Did you find any problems when you did a selfie?
That's funny you asked that because at the moment I did it, I didn't find any problems. But it was just a couple of months later I had abdominal pain. I didn't know what it was, pain like I've never had before. So I took out the probe and I started doing the same things I had done when I did the selfie. One of them was to, do an ultrasound of both kidneys. I said, whoa, my left kidney was really dilated and asymmetric, really dilated. And so I concluded I must have a kidney stone. And I was really sick and I was throwing up. And I went to the emergency room and I said to the emergency room doctor, I said, I want to show you. I think I have a kidney stone. I have a dilated left kidney. You can see it right here. And he looked at me like, what? Like I was an alien or something, Anyway, that's the future. Yeah. That's just a window into the future. Anybody could do it. You would just say to the AI, I want to image show me how to image any organ that could cause pain in my belly. And it would say, okay, let's do the kidney. Let's do the gallbladder. Let's do the, and it would just help you do it. I had to look it up on Google because I never had imaged my kidney. But, when I did the selfie, I had to look up. Certain things are easy, like the liver. That's like the side of the barn. But, I had never imaged my own kidney. So I had to, I said, well, just Google image ultrasound kidney. And there it is. Just tells you how to do it. But now you don't even have to do that. Now you just talk to the AI, or you will.
What about all these hypochondriacs who, are already hassling doctors because they think they have this or that or this? Could drive doctors crazy.
Yeah, that's another problem you're bringing up. There are people who are wired. They're just wired. And you know what? I don't know that we'll ever have a great solution for them, but I don't know that this changes anything. I think they're already wired. They're already, if they're not using this, they'll be going on the internet and looking up symptoms and have the disease or whatever they look up. I don't know that we can solve that problem. I mean, I'd like to solve it, believe me, so cyberchondria or whatever you want to call it. We have to alleviate that, but it's not easy.
I also wanted to ask you while I have you about this Osler's Alliance that you founded to try and bring the doctors under one umbrella. That only started, was it November last year or after your article in the...
Yeah. We started it last year and we had our first kind of town hall last month, and we're going to keep hopefully, growing and nurturing it. I recruited, a bunch of phenomenal young people. A diverse group representing different parts of medicine and, by all diversity at every level. And they are terrific. So I'm just kind of helping in the background, coaching them a little bit, but they are off to the races. And I think this year they'll start to the membership's starting to pick up, and, it's $5 is the membership fee. Unlike the American Medical Association or and so, the whole idea here is to make it that it's for everyone, and it's serving the interests of the patient-doctor relationship. And I hope it'll be successful, because I think we need something like this, and we need to be able to. If we achieve solidarity, if we achieve common purpose and mission for patients, not self-serving, I think it'll help.
That's wonderful. That's because the doctors really came together with this. They were told to stay in their lane by the NRA, and then they all kind of came together and reacted against this. Do you think like COVID could also be a rallying point?
I think so. In fact, we all have thought that COVID really will help this matter, just as you were saying. This whole idea of staying in the lane is just egregious in my view, because we're all going to be patients if we're not already, and physicians are not just one track. We all have lives to live, and this idea that we shouldn't be able to have opinions and have input on things that are unrelated to our area is just anyway. Whenever I hear the stay in the lane, I bristle.
But maybe you can learn from it. Maybe you can, because if the doctors were as well organized as the NRA, it's with such publicity machine. I mean, you'd be a force to be reckoned with.
Well, that's the whole idea, is we need a force to be reckoned with. You said it beautifully. If we ever develop that, because we don't have it now. We don't even have anything close to that now. But had we had it in the pandemic early days, we wouldn't be in the state we're in right now, because we would say, we demand the Defense Production Act or whatever it takes to get us the protective gear, or we demand to get control of this virus. We're not going to care for the patients the way we can't care for the patients if you let this get overrun. We didn't have a stand-up organization to help navigate through this mess here at all.
The biggest business in America, so 1 million doctors.
Yeah,
that surely should be something to rally around and to solve this situation.
I hope so. There will be more pandemics. And by no means have we gotten through this one. This will be an endemic virus for years to come. I hope that this will help seal that need. I mean, I thought it was there, of course, before, but never more reinforced by what we've been through.
Healthcare's on everyone's mind. So, all right. Well, I think that's more than enough inspiration that I can handle. So thanks.
Well, I really thoroughly enjoyed meeting you, Jack, and having the chance to discuss this with you. And you're a fun person to connect with. So I hope we'll have a chance to do that in the future again.
Right, well, I'll get to work on a song. I'll zero in on one of these areas we've discussed. And thanks again for everything you're doing to help everyone.
Oh, no, thank you. I really appreciate it.
Bye, Eric.
All the best. Stay healthy.
We need the doctors to lead the fight. We need the doctors to combine their might. We need the doctors to lead every campaign. We need the doctors to take this on. We need the doctors to be strong. We need the doctors to stand up in our name.
Obesity is killing people, it's an epidemic. Heart disease is deadly, and it's become endemic. Who can end the nightmare? What can stop the pain? Dietitians or marketing campaigns. No, the remedy is universal. Doctors unite. Doctors are stressed to breaking by unnecessary work. Tied down to their keyboards, they are data entry clerks. Who can end the nightmare? What can stop the pain? Medical administrators, this is their terrain. No, the remedy is universal. Doctors unite. We need the doctors to lead the fight. We need the doctors to combine their might. We need the doctors to lead every campaign. We need the doctors to take this on. We need the doctors to be strong. We need the doctors to stand up in our name. There are so many issues, so many fights. From inequality to poverty, don't mention gun rights. But if 1 million doctors work together in one lane, imagine their power, how much they could change. Opioids are overused, a crisis now exists. Doctors serve as drug dispensers for big pharma lobbyists. Who can end the nightmare? What can stop the pain? Possibly new legislation or something in that vein. No, the remedy is universal. Doctors unite. We need the doctors to lead the fight. We need the doctors to combine their might. We need the doctors to lead every campaign. We need the doctors to take this on. We need the doctors to be strong. We need the doctors to stand up in our name. We need the doctors
this song. We need the doctors to be strong. We need the doctors to stand up in our name.
The remedy is universal. Doctors unite. Thanks for tuning in. Of all the podcasts in all the world, I'm glad you chose to listen to this one. Thanks for taking the time. If you enjoyed it, please rate it on your podcast app. Share it. If you like the song, you can listen to it on Spotify, Deezer, iTunes, everywhere. If you really want to support, you can buy it for $1 from Podsongs.com and send it to a friend by email. Try and spread the love. I know nobody downloads anymore, but what can you do? And I'm also joined Patreon as well. So if you really want to support, you can sign up there as well. Thanks for all your messages and your words of encouragement. I do appreciate it. And thanks to my musicians, Mauricio Sanicola and Massimino Vozza, and my researcher, Dori Verbo. Alright, see you next time.